Welcome, everyone. Thank you for joining us for our Maine Health Monthly Monday webinar series. This is a partnership between Maine Health and JMG to help increase awareness and build knowledge about different career opportunities and pathways that students could pursue in their post-secondary planning. Today, we have a really interesting topic. We are talking with Summer Wirth, who is a EEG clinical supervisor at Maine Medical Center. Summer, thanks for joining us.
Thank you for having me.
Yeah, so we are, I think it's always good to start with your individual career path. How did you land in your current role, and did you always want to work in healthcare?
I honestly could never have guessed in a million years that I would land in healthcare. I, graduated high school and floundered a bit throughout college, changed degrees many times over, and had trouble figuring out what was going to be the best path for me. And it wasn't until I linked up with a brilliant career advisor through my community college that I realized I was looking at things all wrong. I was very set on picking out my interests, my passions, and trying to find a career that meshed with what I was most passionate about. And I realized that rather I needed to look at the kind of lifestyle that I wanted to live. And so that career advisor, asked me to think about what 3 characteristics would be most important to me for job related to more so long-term lifestyle choices. And so that's when I realized that job security was going to be really important for me, job mobility, being able to move anywhere in the country and take my career with me and easily be able to find a job wherever I wanted to live. And also wanted to look at scheduling. I grew up in a household where my parents worked, typical Monday through Friday, 9 to 5 jobs. And so when I realized that I could work 3 12-hour days and have 4-day weekends, or 4 10-hour days and have 3-day weekends, that I could work nights or work a mid shift starting at, an afternoon and have the whole mornings to myself. That was what really sealed the deal for me, knowing that I could still have a career that was really interesting and I could enjoy what I was doing, but I had a lot of job security and free time outside of work to live my life and pursue my hobbies. So I started looking into technical occupations because I also knew that I didn't want to go for another degree. And I found multiple technical occupations that were 1 to 2 year programs. However, the only one involving the brain was neurodiagnostics. And so I knew at that time that I wanted to do something brain related just because I found the brain to be arguably the most important organ in the body and also the most mysterious. So I decided that, I was just going to go for it and try out neurodiagnostics.
That's incredible. Wow, there was so much good information in there about I love the perspective that career counselor gave you of like thinking about your lifestyle in addition to the things that you really like to do or how you like to work. So I love that. And I can already see that that's going to be a beneficial kind of way to approach things for our students. I think it's probably important to talk about what is an EEG? What does it look for? Maybe that, like bringing that context in for students, you mentioned the brain, but maybe let's start there before we get into like what the role is.
So there is quite a wide umbrella when it comes to what we refer to as neurodiagnostics. So there are all kinds of testing modalities related to the nervous system, not only the brain, and EEG or electroencephalograms is one of those various modalities. So within the scope of neurodiagnostics, there's a ton of things you can do, but EEG tends to be the gateway to that. And the EEG is looking specifically at the electrical activity of the brain. And what we're doing is an EEG tech applies about 2 dozen sensors in the standard EEG hookup to the surface of the head. Nothing invasive. We don't use any needles. So it's really just a lot of sticky stuff holding these electrodes in place in very precise locations. And the electrodes act as little microphones that are picking up the electrical currents in the brain. They're amplifying those tiny currents so that they populate as waveforms on a screen. And it's sort of a moving picture that changes second to second. So it's really exciting to watch those changes happen over time. And what we're looking for is abnormal electrical activity in the brain, such as a surge of electrical potential that could be related to seizures. So the primary thing we are looking for with EEGs is to diagnose and treat seizures or epilepsy.
Great. So the technicians will actually be responsible for placing those sensors on and reading the, what they're spitting out. That's not the technical way to say it, but they do
So
both.
exactly. So it is one of the things I love about EEG is it's a very interactive process. The process of performing the EEG from start to finish takes anywhere from 1 to 2 hours. It takes about half an hour or so to set up the EEG. And what we're doing is we take measurements of a patient's head, and we get to draw on their head with washable marker to help guide placement of those electrodes based on the measurements that we're taking. Then we prep the skin. We're used to working with hair. We don't shave patients' head. We just part the hair as best we can to get to the scalp. And we prep the skin. We clean it up a little bit before we actually place the electrode on with paste. And so we do that about 24 times over. And all of these little contact points are then feeding information into a machine that we are at the helm of. So not only do we have, this patient interaction where we're sort of interviewing our patients as we're setting them up for the EEG to get more details about the symptoms they've been having. And that information is very helpful to the doctor who's reading the EEG and helping to diagnose. But then when we're actually running the study, we're interacting with our machine to make sure that we're getting the best possible recording. So with EEG, there's a lot of troubleshooting. We're working on a computer system. We're working with electrical currents. So there are a lot of principles of electricity and electrical safety that you learn about in school with EEG. Additionally, because we're reading from all these different contact points, it's very easy to get some sort of interference or artifact in each and every channel. So it's our job to monitor to make sure the picture remains clear and static free throughout the process. And we have all kinds of different filters and parameters that we use on the machines. So it's not the kind of thing where you just place the EEG and hit go and let it do its thing. We are constantly monitoring and adjusting settings on the machine. So it's a very engaging process, and it's very detail oriented. And so you feel really engrossed throughout that full 2-hour span.
That's really great to hear. So I was thinking about, two questions come up, probably more than that, but these two are coming front of mind. Is there different, do you work with all ages? So like kind of young all the way up to kind of the elderly? And then do you work in different environments? So like hospital-based technicians versus, maybe in a smaller doctor's office or an outpatient clinic? Could you speak to those things?
Absolutely. We do a bit of everything. EEGs can be performed on neonates or newborns, all the way up through geriatrics or older adults. And we do everything in between. So we do work a lot with pediatrics and with adult populations. And one of the many things I love about EEG is that there's a lot of diversity in the various care settings that you can work in. You can work in a hospital and see patients that are admitted for various medical conditions, or we do see patients at our outpatient office as well, where you're working with patients who don't need acute or emergent medical services. Rather, their conditions are being managed on an outpatient basis. So you get that really wide range of patients who are walking, talking, alert, oriented, able to drive themselves to their appointments and come and see you, all the way to the hospital bedside where you're in an intensive care unit with a patient who is on a mechanical ventilator because they can't breathe on their own and are on a lot of life stabilizing devices. They have IVs for medications and that kind of thing. So it really spans the gamut, which keeps things interesting as well, because EEG looks very different on those patients in the hospital versus those that are at the outpatient office.
Yeah, and I imagine schedule, like you mentioned that in the front end, schedule kind of would play into those locations too, in terms of if you had a preference of how you wanted to work, or days wise, hours wise, shift wise.
Exactly. So typically, it would be a standard Monday through Friday daytime position at an outpatient office versus a
Yeah.
hospital where they do have those daytime positions, but they also have mid shifts, night shift coverage, weekend coverage. So you have a bit more flexibility with scheduling typically in the hospital.
Yeah, that's great. Thank you for sharing that. I think that's good context to have. Um, so we've been talking about EEG technicians. Could you talk about the training or education required of those folks to kind of be a practicing technician? And um, at the tail end, could you kind of talk about like the salary ranges that you're seeing for these positions? We've talked about more training, what that would look like. What's the starting scale and kind of like the higher end, if you could share that.
Sure. So EEG, because it's very niche, most people do not know about the field of neurodiagnostics or what an EEG even is typically. There aren't a ton of techs, which means that over time, a lot of hospitals or medical facilities have on the job training programs, and they're entry level. And the association that manages our accreditation for being a registered tech. They have made it very easy for just about anyone to enter the field without having a formal education. So even if you're just a high school graduate, if you have an associate's degree, a bachelor's degree, postgraduate degree, any of those people can have equal opportunity entering the field. So the way they determine how quickly you can become a registered technologist depends on your education level and your years of clinical experience. So if you are fresh out of high school and you're wanting an entry-level EEG position, you can obtain a job and work in the field. However, you'll probably need about 5 years of clinical experience before you're eligible to sit for your EEG boards.
Got it.
That being said, we aren't as heavily regulated as a lot of other medical careers. For instance, nursing, you have to be registered to be a nurse. It is not that way in EEG. You can be an EEG technologist without being formally registered with our accrediting board. It's encouraged that over time, you'll decide to sit for your exam and become a registered tech, but it's not absolutely necessary. You can still fully function in our field and, perform the job from start to finish without being registered in EEG. So it
That's
just
great.
depends. Yeah. So it just depends. As long as you have an associate's or a bachelor's degree, it's very quick that you can become an EEG technologist just by working in the field for, 6 months to a year. Then you're able to easily sit for your boards. So it is possible no matter which background you're coming from. It just might take a little longer.
Yeah. Well, but I like that career ladder that there's kind of an entry point for, even if people are changing careers. You mentioned in the front end how your college degree, like people change their degree, 2 to 3 times. I think the average it might be more now, but I think that's the same for careers after, school that we may change our careers 2 to 3 times over our lifetime. So this is just really good information, I think, to have.
And I figured I should specify when I say an associate's or a bachelor's degree, that does not have to be an EEG or neurodiagnostics. They're literally just looking at an associate's or bachelor's, regardless of which field of study. There are programs that you can get an associate's or a bachelor's degree in neurodiagnostics. They do exist. They're few and far between. More commonly, there are technical programs that provide a certification for EEG. So those are typically about a year long. A lot of them are virtual. So you can go to EEG school online and establish just a clinical site for your hands-on patient care practice. And it's your responsibility to establish that in whichever area you live in. So there's a lot of flexibility there. But if you go through one of those formal EEG programs to get a certificate or a degree, that is the quickest and easiest pathway to become a registered tech. But again, you can just have a high school education or have any kind of associate's or bachelor's degree and quickly go through the process as well.
Yeah, no, that's exciting. That I really like that. You hit on some of like the interests or skills that would make somebody really a good fit for this role, kind of detail oriented, variety of work. Could you talk? I may have taken some of your answers there, but could you elaborate on like what you see might make someone a good fit?
I think most importantly, you have to be very inquisitive and investigative, because we are, as we often say, the physician's eyes and ears at the bedside. We are often asked to, gather patient history. So we have to make sure that we ask the right questions that would be related to, the neurological symptoms that they're experiencing and the reason why we're performing the EEG. So you kind of feel like you're hunting a bit, and you're trying to get to the bottom of, what's going on for these patients. So you definitely have to be curious. And you also have to be very methodical in your approach. There are a lot of steps that we go through in gaining understanding of why the patient is with us and what we're looking out for during the recording, but also because EEG is such an intricate modality and there are so many steps to what we're doing and we're so engaged throughout that 1 to 2 hour process. There is a very specific kind of protocol that we follow. So if you enjoy organized tasks and being able to go through a list and sort of check off item by item, it's a really great career for that. I also think, in addition to having that diverse array of environments that you can work in, if you enjoy just being active, especially working at the hospital, you get your steps in. Patients don't come to us at our lab, at least we go to them. So we visit every unit of the hospital. So we're constantly on the move. We're usually on our feet at bedside when we're taking care of patients. So if you enjoy, being active, it's definitely a good fit.
That's great. What would you say for you personally is the most rewarding thing about your job? And, maybe give us the flip side too of what is one of the biggest challenges that you see?
I think the most rewarding aspect for me has been giving back to the community. I think all of us like to help others, but you don't really get a feel for that until you're in it long term and you get to see the same patients over and over again. And it's not just because they're getting sick over and over again. It's because if they have been diagnosed with epilepsy, there's a lot of follow-up involved. There's a lot of check-ins, every 6 months or every 1 year. And so you get to know patients and you have a rapport with them and with their family members, and you get to grow with them and learn about, changes in their lives. And it's especially rewarding in pediatrics when we get to watch the kids grow up. So it's really nice to have that relationship with patients, with continuity of care and seeing the same patients multiple times over. And, they remember your name and they send you Christmas cards and, they request you sometimes if their test is scheduled, they'll ask for a specific tech just because they so enjoy working with you. So I think that's been the most rewarding part for me, knowing that I'm giving back to my community, but I'm really seeing the results and that, I constantly get, that feedback from my patients.
Yeah, that's awesome.
I think the most difficult part is probably twofold. One part that's a little more, department based would be staffing shortages. I know it's common in all areas of the hospital. However, it's been pretty difficult to maintain with, over the past 3 years, we have 50% of our staff
Wow.
left. And I think a lot of that is through COVID. A lot of people
Right.
decided to, reevaluate their career and change course. But we haven't been able to recruit new EEG techs. So it's been a lot of hard work, a lot of long hours to keep the ship afloat. My friends that are EEG techs as well, throughout the country seem to echo the same sentiment. It seems to be a challenge everywhere to fully staff a department. So that can be taxing. And I'd say also working in the inpatient environment, sometimes it can be really difficult to see critically ill patients. There are a lot of really heartbreaking stories. A lot of times when we're performing EEGs, there are family members in the room visiting patients, and that can be a really emotional experience. So you have to be a mix of, empathetic and sympathetic, but, part of that too is you become a little more hardened over time, not in a bad way, but, you have to try and be as professional as possible and do the best job as you can. and do what's best for patients without getting too wrapped up in the emotional component,
Yeah.
which can be hard to do sometimes.
Yeah, I imagine that's a balance for sure. Um, so you actually, I was going to ask about staff shortages. We're seeing that across the board in a lot of different healthcare professions. So your area seems to be no different, but I love that maybe through this conversation, we will have inspired some youth to, look into this a little further and see what a great career ladder and points of entry that they could kind of go to start in this field. Um, and actually, to that end, my last question for you is, if a high school student now is super kind of intrigued by this conversation, what would you suggest they do from here to kind of further look into this area?
I think most importantly, a job shadow would be the best idea. And I know our lab is very open to it. And other labs that I've worked at across the country are open to it as well. Just hang out with an EEG tech for a couple of hours, see what it's all about. I think that's the best way to get a feel for what we do. If you're not quite ready to reach out for a job shadow opportunity, definitely YouTube it. Look at lots of videos to get a feel for, how meticulous the process is, which also makes it rewarding in a lot of ways. But I feel as though you can gain a lot of experience just by checking out a couple of different websites. As far as the Neurodiagnostics Society, they have a ton of information on there about our field, different courses you can take just to learn a little bit more about different aspects of neurodiagnostics. And that's a great way to gain some exposure and learn about more opportunities in the field. So between researching the Neurodiagnostic Society and maybe doing a job shadow, I think that should give everybody a great idea of what they might be in for and if they feel like it's a good fit.
That's awesome. Wow, you might be getting some inquiries soon from me then based off of this. No, this has been a great conversation. I know I learned a lot. I'm sure the students are definitely learning from you, and we just really appreciate your time and expertise and sharing with us a little bit behind the curtain of what you do.
Yeah, thank you so much.